Welcome to our podcast on homelessness in Placer County. I'm Bonnie Gore, and I serve on the Placer County Board of Supervisors. I represent District 1, which is primarily the city of Roseville and the unincorporated areas of West Placer County. Placer County has about 417,000 residents, and of those we have about 700 residents who are homeless. Placer County has the lowest rate of homelessness in Northern California, and our goal is to drive that rate even lower. My goal is to inform and educate the community about the good things we're doing to address this issue, and also discuss the challenges we face.
The homeless crisis in America is out of control, and nowhere is this crisis more apparent than in California.
Even in smaller suburban cities like Roseville, the number of people living outdoors is on the rise.
If we were to act now and strategically, I think we could make Roseville the model for stop it before it gets there.
My conversation today is with Dr. Rob Oldham. Dr. Oldham is the Director of Placer County Health and Human Services and serves as our county's interim health officer and chief psychiatrist. Dr. Oldham previously served as Placer's health officer and director of public health from 2014 to 2019 and returned to the county after serving as the chief medical executive for Sutter Center for Psychiatry in Sacramento and as medical director of acute psychiatric services across the Sutter Health System. Dr. Oldham received his Doctor of Medicine from the University of Alabama in Birmingham, where he also completed a health policy fellowship and received a Master of Science in Health Administration from Virginia Commonwealth University. We're talking about Health and Human Services today with Dr. Oldham because HHS collaborates with local partners to lessen homelessness. They offer a range of services including outreach, safety net enrollment, crisis and behavioral health support, and they work with law enforcement and local communities. And HHS, along with city governments, community-based organizations, and community representatives, actively participate in the continuum of care, the state and federal mandated entity that has the responsibility of planning and organizing and delivering housing and services to meet the needs of people who are homeless as they move to stable housing. Dr. Oldham, we know that Health and Human Services is involved with the issue of homelessness on many levels. So can you talk to some of the broad efforts HHS has undertaken?
Yeah, so we're doing a lot with HHS. I think it's important just to say, we serve all of Placer County, including the cities, and so we're the largest department in the county and have just a wide variety of different services that we provide. But we look at homelessness first is to say, we people who experience homelessness utilize all the other services within our department as well. And so our focus on improving access to all of our services is particularly important for this population because they're so vulnerable. So kind of starting there and thinking about especially some of the factors that contribute to homelessness, exacerbate and perpetuate homelessness, like behavioral health, mental health, substance use disorders. And so our efforts to make those services more accessible to the community lift all boats, but especially for people experiencing homelessness. So kind of starting there. But some efforts that are particular for people experiencing homelessness. Actually, we've been at it for many years, and I think when we talk about why Placer, our rates of homelessness are significantly less than a lot of other communities, I think it's because of the investments that we've made over the years. So one of the biggest ones that you're hearing a lot about recently, you might hear about the home key, the different home key funding from the state to provide permanent supportive housing. But that's not anything new. The home key funding is new in the last 3 or 4 years, and we've been really successful at those. So that's one of the things that we're excited about. In fact, we've with the home key round 2 that is allowed us to purchase the former Hampton Inn on Douglas here in Roseville. With that, we're actually doubling the number of permanent supportive housing units, the total number in Placer County just within the last 5 years. So in fact, that is the largest increase in permanent supportive housing that we've experienced in our history with 82 new permanent supportive housing units. So
Well, let's talk about permanent supportive housing because people probably don't know what that is.
Yeah.
Right. And I tell folks, well, it's a location where somebody who's gotten stable, they've been on the streets, perhaps, they've gotten stable, but now they're ready to actually be in a permanent home and they pay a portion of their income to live there, correct?
right.
So they're like a renter.
Exactly. They
And-
have a lease and yep.
Okay. And we've been able to provide about 192 units
Right.
in Placer County over the last 20 years, correct?
Exactly. Yeah. And so that and using those historically have largely been for people served by our behavioral health system. So people with serious mental illnesses, and a lot of that funding has come through the Mental Health Services Act. But then more recently, another big initiative you may hear about is whole person care, which now has changed the funding stream and the name has changed. But the idea is still the same of really providing intensive services to the most vulnerable of the people experiencing homelessness, the people who've been chronically homeless. And a lot of those people, so a lot of people when they experience homelessness don't need all these supports in place. They just need, a little bit of a hand up or assistance to get back on their feet, maybe some emergency rental assistance or other things. But for people with serious mental illnesses, other medical conditions, other ongoing factors that contribute to their chronic homelessness, many of those folks need these extra supports like that you can get in permanent supportive housing. So with whole person care was the first time that we had funding that wasn't specific to folks who had diagnosed serious mental illnesses, but from others who needed those supports. And then with Home Key, it kind of expanded that pie even more. So we're able to serve a lot more people with those supports, not just those with serious mental illness. But you're exactly right. For 20 years, so that's about the Mental Health Services Act is about 20 years old, and so that's we've been here in Placer County putting a significant proportion of that MHSA funding towards housing for people with serious mental illness all along, which I think kind of goes back to why are we experiencing some much lower rates of homelessness here in Placer than other communities. A lot has to do with the social determinants of health, like why we're healthier than a lot of other communities as well. So we have strong education system. We have a good a good economy, good jobs here. Other things that kind of help people, giving them supports. But also I think it has been our investment in things like permanent supportive housing over the years.
So we've done a really good job of helping people get supports they need, types of services, whether it's medical or mental health services, getting them the services they need, and then helping them transition into housing, which has kept the number of the homeless a little bit lower in our community than we might see in other places.
That's right.
Which is really good, but we still have homeless on our streets, right? And that's the challenge. And Placer County, our homeless population hasn't increased as much as it has like statewide, right? So we have the lowest rate of homelessness in Northern California. That's really good. But let's talk. You've talked a little bit about why that is. We've talked about our numbers are a little bit lower, probably because we do have more jobs, people have more supports. We've been able to move people off the streets, but we still have homeless here. Let's talk a little bit about why else people would end up on the streets in Placer County.
Yeah, and we've done some studies here locally of this question, but also have a very nice statewide study that's been done. Actually, one of the largest studies of homelessness in like the history of the world happened here in California, right? That the state, along with UCSF, helped to sponsor this. So really understanding what are those factors that contribute to homelessness. And so, here locally, our experience when we survey people experiencing homelessness, a high percentage of those people struggle with either mental health concerns or substance use problems, or often both, right? It's co-occurring at the same time. I mentioned kind of other medical issues that contribute. Sometimes they become unable to work as a result of either behavioral health or medical issues or other things going on. Domestic violence is also a major contributor for women, often men and women, but especially women who experience homelessness. Many of them have experienced domestic violence. Those are three big ones, but just economic factors, and that's what the statewide study has shown. It's just a lot of people, even in Placer, which is one of the wealthiest counties in California, but we still have a lot of people living paycheck to paycheck, and so they experience a few kind of economic setbacks that make it where they can't pay their rent anymore, and so that's a subset of the population. Like I said, a lot of those people aren't the ones who necessarily need permanent supportive housing, but that's also when we look at our counts, a significant proportion of those are folks who have more economic factors that contributed to their homelessness.
So a little bit about personal items, sometimes issues, and then sometimes it's economic issues. But by the time somebody ends up on the streets, they've sort of worn out their welcome, right? By the time they get there, they've worn out their welcome, and I think there's this question about people might assume these folks don't want help. They're on the streets, they don't want help. What have you seen, right? Your team has worked with the homeless population a lot. We have folks from HHS go out and meet with homeless. You provide services. What have you seen? How are we helping people actually get off the streets? And does it work? Does providing services to folks work?
Yeah, so we've done a lot working with other departments, other disciplines, especially with law enforcement, and going out and engaging people who are already on the street. So there's other things that we do to try to prevent homelessness, or work with people who maybe are couch surfing or in a motel for a little while. But yeah, for those people, particularly those who are chronically who've been on the street for a long time, a year or more, really focusing on those. I mentioned whole person care. That was a lot of what it was doing. We actually had separate funding to do outreach, to go out and outreach to those people, develop relationships, and to address their behavioral health concerns, medical concerns, and other things that contribute to their homelessness. These are chronic factors, so kind of have been around for a long time. And so, me as a physician, we know chronic illness is often you need to keep coming back and addressing those, and it's especially true for the people who are homeless, who are on the street. That's our experience. Is some of them, you go out and intervene, one or two times that are able to get them, back on their feet and housed. That's more the exception than the rule. So often needs a repeated engagement, developing trust. And so I think these teams of people kind of dedicated with law enforcement, HHS, and others to go out and do that outreach of folks who are good at this. So not everybody is it's not for everyone to do that type of outreach, but also that you have the same folks who are going out and doing that outreach, building trust, building relationships is really helpful. Having resources to actually direct people to, so that when you go out and engage with them, that we do, for instance, have a bed if that's what we're trying to encourage them, or we can get them into behavioral health services. So back to access, it's really important that we have that access to those services. The lesson learned, and that we're recognizing that we're not, although we've had a lot of success, that probably the majority of the people that we're contacting may not be going into housing immediately. And so, for instance, the data from Whole Person Care was about 5 years. We served over 500 of the hardest chronically homeless people, a lot of them who have been homeless for years here in Placer County. About 200 of those were permanently housed, so which is fabulous, right? But the flip side of that is, even with all those resources, engagement, we had the majority of the people, maybe 300 plus, who aren't permanently housed right now, who are still kind of going in and out of homelessness here in Placer County. So I think having the expectation that this is very resource intensive to do the outreach, particularly for those who are chronically homeless, but it works. I think it did help us to address the big problem that we had with chronic homelessness. We had a national consultant who came in and assessed Placer County, Dr. Marbut, and found, while Placer doesn't have nearly the same problem with homelessness that a lot of other communities do, we had a big problem with chronic homelessness. So that's lessons learned, and I think we still have a lot more work to do in that area.
Let's talk about the city of Roseville, because if we look at countywide, the most homeless that have been accounted for are in the city of Roseville. Let's talk about why that is. Why would there be more people in the city of Roseville who are homeless than in Rockland or Lincoln? And some of that is definitely population. Yeah. This is a bigger city. But why would there be more people in Roseville if you take away just the population factor?
Yeah, well, and this is, like you said, it's consistent with population. I believe, the rates that we see across the state is larger cities tend to have even higher rates, right? And so one of the reasons we talk about why does Placer have so much lower rates than other counties in the region, some of those have large cities where you do tend to see more concentrations of homelessness. So I think it's natural to expect our largest city to have slightly, not just higher numbers, but higher rates of homelessness. The other factors that may contribute to that, I mean, we've talked about having somewhere for people to go. We have a lot of our services concentrated in North Auburn right now, especially for services for people experiencing homelessness. So there are some factors as far as the types of services and in the model of services. Here in Roseville and South Placer is very different than the models of services that we have in other parts of the county.
Great. Let's talk a little bit about the point-in-time count, which is a federally mandated count that's done every year. And talk a little bit about why that's helpful for us. So it's done every year, January 25th. We count the homeless in the county. How is that helpful to our HHS department?
Yeah, and I'll say it is. Maybe we'll start by saying it's helpful. We try not to oversell the value of the point-in-time count. It's a flawed count for sure. So it's just what the count of people. We have a lot of staff and volunteers who go out one day per year to kind of figure out where and ask the question of people who they encounter. Where did you sleep last night? So we get a snapshot of where people, how the numbers of people within the county, but also where they are and what types of where they're sleeping, but other questions that data that we get. And so the value is it's consistent. We ask, we make some adjustments from year to year based on what the feds and the state tell us to do. But in general, it's consistent from year to year. It's probably best to compare to ourselves. So you mentioned, we actually had a decrease in the number. We actually had the last couple of years have seen a rate decrease, the rate of homelessness in Placer County. Last year we actually saw an absolute decrease in the number, and so that's meaningful because even though it may be a flawed count, it's kind of flawed. We don't capture everyone who experiences homelessness, certainly not over the course of the year. But we have the same methodology every year, so it's really helpful in seeing how are we doing here. Here in Placer County. It's also helpful because we get a jurisdictional count, so we can see within Placer County kind of where people are and maybe seeing some movement of folks between jurisdictions. And then finally, I think it's less useful, but still useful in comparing us to other jurisdictions. So you mentioned we have the lowest rate of homelessness in Northern California. And so that's, that we're, but we also know, and we can see what's going on, for instance, in Sacramento County, which can impact the way, the services and the way we deliver services. And so I think that's useful to kind of know the landscape of other communities as well. We get a lot of data about, back to why people are experiencing homelessness, what types of services that they're utilizing, and what types of services they may need that helps our continuum of care to adjust and add on new services and change to meet the needs of our local population.
Great. Let's talk about myths of homelessness. Yeah. What are some of the myths that you see about the homeless population here in Placer County?
Yeah, well, I think there's a lot, and it's just so easy to see this problem, and I think we all experience this cognitive dissonance, and emotionally we see people in our neighborhoods who are experiencing homelessness. It's so hard to understand. Well, how did this happen? And so it's natural, I think, that individuals and even groups to kind of come up with ways to explain, to help us to understand why this is happening. And so it's hard to just think of like these are people coming from our communities, right? But I think that's one of the myths is this belief, and it's not just unique to Placer. I've been in other communities too where you hear this of like, oh, well, these are people who are coming from somewhere else, and there's something that we're doing that's attracting, people experiencing homelessness to come here. There's always a grain of truth to that. So there are some people for sure who migrate here, just as we have some people who are from Placer County who go elsewhere and experience homelessness there. But in general, what we find is the majority of the people who are experiencing homelessness in Placer are from here. Many of them, I know we had a consultant who asked the question, where do you go to high school? And said, people not only were able to say, Placer High or Del Oro or Granite Bay, they're able to, say, go Grizzlies or go Golden Eagles. They were very, very, very tied to their communities. In fact, don't really even want to go from Roseville to Auburn or vice versa. They're very, very tied here. So I think one of the myths is that, that this is because, people, I hear a lot, which may have been true in the past of, we have the railroad, and this is from people getting off on the railroad. That was one that Dr. Marbut kind of assessed and said, no, that may have been in the past, but now is not really as significant. There may be one or two people, but it's not what's driving, most of the people into homelessness here. It's kind of locally, people locally who've experienced homelessness.
And it's an issue statewide, right? So
yeah.
we're like every other community. We have an issue here, and most of those residents consider themselves from Placer County, from Roseville, from Auburn, what have you. That makes sense. And what do you see as some of the challenges? What are some of the challenges you see coming ahead of us or coming that we need to continue to address as a community?
Yeah, well, one of the challenges is just around our continuum of care, and so we have certain gaps in our continuum of care. I mentioned our permanent supportive housing, where we've been able to expand that. I think there may be more opportunities to expand and have more with state and other funding to draw that down and to create more. When we do the assessments, although we've doubled more than doubled our permanent supportive housing units in the last 5 or 6 years. We still there's still a need there. So as soon as those open up, they fill up, and so continuing to develop that piece of the continuum of care. I think there are other pieces of the continuum of care. A shelter being one where we've added more shelter beds in North Auburn, but here in South Placer. We have a model, a nomadic shelter model that even in the 2015 Marbut report he identified as, that's going to come back and bite you one of these days. And so, 8 years down the road, it continues to be an issue. And I think, talking with the churches and others who are part of that nomadic shelter model, they kind of recognize, it's really struggling. So those are two. I think just changes in our behavioral health landscape is another one that we're tracking with. The governor has a lot of statewide initiatives addressing behavioral health between CalAIM and care courts and a lot of other things, which I think offer a lot of opportunities. But also there's the concern that I mentioned, whole person care, that as things keep changing, the most vulnerable populations often do fall through the cracks. And so that's one of the concerns that we continue to lift this population up and have ways to track to make sure that with all the changes that they don't fall through the cracks, especially in our behavioral health and the medical, a lot of changes in the medical system, the safety net medical system too.
So that means our staff have to really make sure they're doing what they need to do to provide the services, make sure that we're utilizing funds where we can so that we're not stopping any type of services. And the state's got a number of mandates coming down the pike probably this next year. And how do we do what the state says, yes, you must do, while also maintaining our current level of services? Exactly. That'll be definitely a challenge for our team. And it may mean as well that we have to use not just state dollars, but local funds to address the needs in our community.
Yeah, absolutely. That is one of the big challenges, because here locally we really try to minimize the local funds, and I think our recipe for success has been to try to maximize the state and federal dollars as much as we can, and try to we like to keep our taxes low, and but at some point for some of these services like shelter, some of the pieces of our continuum of care, there's not a lot of state and federal dollars. So the good news is without the state and the feds telling us what to do, we have a lot more local control over how we deliver those services. The bad news is, it might take some additional expenditures at the local level.
Thank you for your insight. Rob, you know so much about this issue, probably more than you thought you ever would know, but it is a challenge we have in our community, and I'm really grateful that you and your team are working so hard to help us as a community do what we need to do to address this challenge of homelessness, but also address the needs that the residents here in our community need.
Oh, thank you, Supervisor Gore. Let me just say, we have a great team within HHS. I certainly, I'm not an expert. I think we've all gained expertise in homelessness as it's become a more visible issue. But really appreciate you investing. You've really become an expert in this too. So you kind of taking this on. And it's one of our most challenging policy issues kind of coming out of COVID. And so I really appreciate your leadership and continuing the discussion around this really important community issue.
Thanks. Thank you so much for joining us for this conversation about homelessness in Placer County. If you haven't had the chance yet, please listen to our other episodes at placer.ca.gov/podcasts. While you are there, you can check out the other Placer County podcasts, One Pill Can Kill, about the dangers of fentanyl, and The Placer Life, which shares interesting stories of the amazing people and places in beautiful Placer County. If you want to know more about the work of homelessness in Placer County, please go to placer.ca.gov/Bonnie Gore.